Good morning, everybody. Today, I really want to talk a little bit about the color box, how we can fix our color box. Maybe some of the healthcare providers, maybe they're doing their studies for the vascular studies or maybe for some other studies, but they are evaluating blood flow to see if the blood flow is within a normal limit, if it's velocity, or we can say that average velocity, if it is correct or not, if the flow direction is okay or to the normal direction or not. So maybe I think some of the healthcare providers, specifically those doctors or other healthcare providers who are scanning and they use the ultrasound machine, what is the best way to put your color box? Like sometimes we need our color box to be tilted to the right, sometimes we need them to be to the left, and sometimes we need them in the center. Now the question is, what is the best angulation for these color boxes to get the accurate blood flow and to get the more diagnostic picture, which is really close to the diagnosis? Now it's easy and simple. Let me make it very simple and super easy. It's all about related to the ultrasound physics. Now, we all know that we have two type of shift. One towards the transducer and away from the transducer. These are the two Doppler shifts we have it. Now, either the flow is coming towards where the source of the pulses are, where the transducer is on the skin. So either the blood is coming towards the transducer, or either the blood is going away from the transducer. So we want to have the best Doppler shift to catch it. Doesn't matter the blood is going away or the blood is coming towards the flow. Now, where we can tilt our box to the right, to the left, in the center to get the more accurate and to get almost 100% Doppler shift, close to 100% of the Doppler shift, because the 100% Doppler shift will be in a 0 degree when you are inside of the vessel. That is the 100% on that case, because cosine of zero, it just go by one of the formula that cosine of zero has to be 1. Now that means 100% Doppler shift. So 100% Doppler shift we only can get when you are inside of the vessel, or if you are scanning a vessel which is completely parallel to the blood flow. The main axis beam and the blood flow are completely each other. They are parallel to each other. On that case, for example, when we do echocardiography, if you want to scan from apical 2 chamber or apical 4 chamber, but you're looking for example, mitral valve. If you're looking to mitral valve, now if you make your main axis beam of the sound completely parallel to the mitral valve, now the blood is coming from the left atrium to the left ventricle. So it's coming straight where the probe is. So that will be completely like a 0 degree on that case. Perfect Doppler shift on that case. We will be not able to miss any of, if there's a regurg, if there's any insufficiency of the other valves, we cannot miss even if it's a small amount of that. Now, for the echocardiography, we have a window of 0 to 20 degree. That is their angulation for echocardiography. Those doctors or healthcare providers who is performing the echocardiography. So for them, for example, they want to do any valvular evaluation for any leakage or rigors. Try your best to make it more parallel. Or if you want to rule out any of the ASD or VSD, so then find a window which make your main axis beam, and also where you want to evaluate that septum. For example, we want to do this in our, for example, VSD to just rule out ventricular septal defect. Now, what is the best angle? What is the best window for that? So, like we said, the best angle is to have 0 degree angle, which is more parallel with the flow. The main axis beam and the flow are on the same direction. Doesn't matter, same direction or opposite direction, but they are parallel. That is important. They have to be more parallel to each other. And also, now the best window for that to rule out ASD or VSD, you can use a lot of windows for that, for example, but the best which give you really accurate information, Like subcostal. That will be because your sound coming this way, and this is your septum. Now, if there is a shunt, that abnormal shunt, you can see it. Now, pretend it, for example, if the blood is coming from the left ventricle to the right, from the left ventricle to the right ventricle. Now your sound is coming from this way. If there is a shunt, now that VSD will be catch very easily, even if it's a tiny small VSD. Simply you can catch it. If it's right to left or left to right, doesn't matter. Or if it's ASD, easily you can catch it because your main axis beam and your flow, they are in a parallel position. Now, if you want to scan a vascular studies, peripheral arteries somewhere, now the best angle for that is, we said, from 45 to 60 degree. That's the angulation where you can tilt or you can move your probe, heel and toe your probe. That is the angle for them. Now, but the optimum angle is 60 degree. Okay, I think we went a little too far, but let's come straight to the box. How you fix your box for specifically for the peripheral arterial diseases to be ruled out, and you want to do evaluation of any peripheral arteries. Now, I will say the easiest way is all of the transducers. For example, pretended this is a cell phone, but pretended this is a probe. Now, each probe have an indicator. There is an indicator, we say notch of the transducer, correct? Either it's a light or maybe it's a little bit of bulging or something on one of the corner. So, of course, when you do your scanning on the sagittal, you want to open your vessel. In that case, notch of the transducers always superior, more towards the head, more cephalad. So put your transducer and first of all, open your vessel. Now, if you want your box to be on the right side, now no problem. Doesn't matter. I know some book says in this location you have to put it to the left, and here you have to put it to the right. I think don't make it difficult. Make it easy. If you want, just go by one rule. You want your box always to the right. No problem. Put it on the right, but then you have to toe where the notch of the transducer, we have this portion is the heel portion and this is the toe portion. So always toe a little bit your probe, make it more toe. The box, because it's already, you took a decision that my box has to be to the right. I wanted to put it. Now, if you are a doctor, if you are working for somebody else, they want from you to catch a full Doppler shift, close to the 100%, more Doppler shift. They want you to not miss understanding or to not miss any flow because of less education of the physics. For example, let me give you a whiteboard. Let me show you something on the whiteboard. Maybe that will make this a little more easier. Okay, let's see this way. For example, if you have a whiteboard like this, now if we have a vessel, for example, this is a vessel here. This is one of the vessel. Here is another vessel. And here is another vessel. Now, there are three type of vessels I just draw. I mean, three different shape of them. Now, this is a transverse, TRV, I will write. This is sag or sagittal. Same thing here too, sagittal or longitudinal. So this is sag. Now, sorry, this is sag. It's AG. Okay, sag. Now, if you really want to put a box on this one, because if you look at here, this probe was pushed or compressed on the heel side, not on the toe side where the notch of the transducer was. Like I said, the notch of the transducer, if you push the notch of the transducer a little bit with compression or a little more pressure, you put more pressure on them, you will get something like this. The vessel will tilt for you. Let the vessel to follow you. Don't follow the vessel. You let the vessel to follow you because all the control is in your hand. Now, for this box, this one, you have to put your box to the left like this. Then you will get a good Doppler shift. But here, now you have to put your box to the right to get the best Doppler shift on this one. Now, this one, like you don't want too much confusion. Okay, now left and right, where I should do. Now, like I said, simple and easy. Make it very simple. If I want to scan somebody's carotid artery and I want to have proximate distal area, I want the carotid artery, the box to the right, which is normally to the right. In the bulbous, it's to the left. In the ICA, ECA, it has to be to the left. But that's the book says. Now, you really want to do it on your right side because you think you can be confused later, so just do it on the right, no problem. But then it's a little challenge. Why? Because you have to push a little harder on the notch where the notch of the transducer was, which was more superior. You have to push a little harder. But if you want the box to the left always, you want to, for example, we have it this one here, if you look at here, this is the left tilting or angling of the box, and this one is to the right. Now, you want it to the left always. Then you see the heel portion, not the toe portion, the heel portion. Just push the heel portion, and your box is always to the left. I think that phenomena can be easily solved like this. And then if you have here something like that, then you will have a completely like the vessel will be completely filled in case if there is like if it's a normal vessel. But that's on a different story. If a vessel, if somebody is suffering from a plug buildup, or if it's a calcified soft tissue plug, I mean, there will be a missing color on that case. If you fix your box correctly, but you still see missing of some color, then in that case, it means that's not your fault. Then the patient have a disease in that case. But if we put our physics, the box correctly with the vessel tilting, if there's no disease, there's no disease. If there is a disease still, for example, I will just fill like this. For example, just an example. This person and this vessel maybe pretended this patient have a missing color in this area. And also you don't see any shadow, maybe it's not a calcified plug. So you're expecting to see a posterior shadow, but you don't see it. In that case, for example, I will purposely leave that one area without red color. So this is a Doppler shift towards, this is all towards. Now, maybe this one area you see here, it was just missing of the color. It means it's not your fault. Your physics was correct. The person have a disease on that point. Maybe it's a soft tissue buildup, or maybe a calcified, but then with the calcified, you will see some shadow, of course, also. So now, let's come to this one. What you're going to do if you want to do your study for the transverse imaging, then in that case, your box is always in the center. So put it in the center. But keep in mind, if this blood flow is towards, for example, I want to scan a CCA of a patient. Now, if this is my probe, this is important, guys. If this is my probe, if you put it completely 90-degree, either you will not have a flow, you don't see a flow, or you may see a little bit of flow, or you may see a two-color flow towards and away because you are on a 90-degree. So 91 will be away, 89 will be towards. So you will see a mixture of the color, which make your diagnosis confused, make it under question mark, because you see kind of a turbulent flow. You see two colors. That is an indication of a turbulent flow towards and away. So that is an area. Do not make it towards and away. Either it is towards or away. For example, that's a 90-degree. If I make it towards, the blood is coming from the trunk area and it goes to the cerebrovascular system. So it comes to the aortic arch, and then it just comes to, like, for example, this is my right side. To innominate it from innominate, it's coming to the CCA, right CCA. So now it is towards. The whole color will be red on that case. So this circular artery, because it's a transverse imaging, it's the plan is the transverse. So on this case, you will see everything will be completely red. And that will be an accurate study. But that's again a different story if this patient have a plug buildup or a disease. In that case, then of course you will have a missing color, or you will have a mix of color, mixture or missing color. And that's a different story. But we have to be on the right angulation. So that's a transverse image. Make it towards, or for some reason, anything. Maybe towards is difficult for you or difficult for the patient to give you that positioning. No problem. Make it completely away. Just bring your transducer more away. Now, in this case, when you make it away, doesn't matter. Still, you get a full Doppler shift. This will become, instead of red, it will be blue. But at least you see the flow. It's away in this case. Before it was towards. Now the blood flow is away. What you can do, there is a button on your machine. Find it. It's called invert. You simply invert the color. Not a problem. Now it's blue in that case. But the main reason, the main purpose is on the transverse imaging, when your box is in the center, so either make it towards or make it away. And that will give you the best Doppler shift. So in all these studies, our main purpose is to get maximum Doppler shift. Specifically, we're looking for the blood flow. It can be any flow. For example, if you're looking for urinary jets, try your best to make it completely 90-degree. Like for example, if like I was talking about just earlier, we were talking about the echocardiography. For example, if I am looking for a two-chamber, pretended if this was like I said, make it 0-degree, correct? Earlier in the video, I just said, for example, if you're looking to a two-chamber, when if it's just you're looking for two-chamber, you have this is your mitral valve. For example, you have your mitral valve here. Now, the normal move of the blood is from the LA going to the LV, correct? Now, if you put your probe, if your probe is in this position, in this location, correct? So now, if you look at here, the pulses from here, all this pulse, they are coming here. So this is main axis beam, and this is the blood flow. They are completely parallel to each other. So the more you bring it, I know you have a room of 0-degree to 20-degree, but try your best, go close to the zero. This is zero. That's for echocardiography. For vascular, you can do that, like we said, from 45 to 60 angle, but go close to the 60-degree because the cosine of 60 is 0.5. So at least you can get half a shift in that case. But here, you will get 100% of Doppler shift in this case. Like we said, if you are looking for subcostal window, just I said that before, earlier. Now, if you look at here, if you have see the septum, now, if you have your tricuspid valve and you have your mitral valve, just pretend it. Now, if your probe was putting in this position, right? You're on a subcostal window. Your probe is here. Now, if you look at here, same thing again. You can see the pulses are coming down, right? From the sound. The sound main axis beam is coming. Now, pretend this patient have a VSD somewhere here. So now we will be able, if it's a small VSD, again, you see this flow is completely, they are parallel. The flow is completely parallel to the sound main axis beam. Where the sound is coming, you see it. Either this shunt is towards or doesn't matter, not a problem. Or maybe it's going away the other way, the shunt, but we have to rule out that VSD here. Or ASD, doesn't matter. So these are the Doppler shift. In this case, you get completely 100% of the Doppler shift. And your diagnosis is also 100%. Now here also same thing, you get 100% of the Doppler shift. So now these are small things, but it helps a lot. Maybe your patient is going, next step is surgery. Maybe the surgeon is waiting for you. It's a cardiologist. They want to do some kind of procedure. Maybe it's a vascular studies. Maybe the doctor is waiting for your report. How accurate you are, make it easy for the next person. If it's a surgeon, if it's anybody. So try your best. I know you guys understand these things. Try your best to make your physics more diagnostic. Make the physics, apply the physics of ultrasound on your studies specifically. Doesn't matter if you do 2D imaging, if you do Doppler studies, if you do color Doppler, pulse wave Doppler, continuous wave Doppler, power Doppler. So Even if you're using ABI, ankle brachial index, which is a pencil probe, or PDOT, try your best to use the correct angulation. So I hope you guys get some information from this. So if there's still something is confusing, let me know. Leave your comment. I will try my best to explain it more easier than this. Thanks a lot for your time and have a nice day. See you guys in next video. Take care.